This is Keith Albertson of IISE with another podcast break here at HSPI in Orlando. We have another conference attendee with us. Please introduce yourself, tell us where you're from and what you do.
Hi, I'm Chad Canode. I'm the VISN 8, work for the VA hospital. I'm the VISN 8 Improvement and Innovation Program Manager, basically the regional improvement manager for the VA hospitals in Florida and the Caribbean. And this is my 7th or 8th year at the HSPIC, so I enjoy coming back every year and seeing lots of new faces, but as well as a lot of old friends, both from within the VA as well as private sector, and just a lot of good experiences here.
Well, it's great to have you back. It's our first time back in person in a couple of years. Looking forward to the chance to get to network and meet people face to face again.
Yeah, no, it's definitely great to kind of touch people, if you would, a little bit more than you have been in the virtual world, and all the challenges that we've kind of gone through the last couple of years. It's definitely great to get back to some type of a normalcy of what we were used to, and just the networking and just the interactions with people is human relationships, and networking is a really big part of why we do the conferences, so I appreciate that.
Absolutely. Well, what do you hope to learn at the conference that you could take back with you from the presentations and the speakers?
Yeah, one of our big focuses within the VA is spreading and sharing of strong practices from facility to your region to each other, and so we do that daily as much as we can within the VA. But it's not just the VA vacuum. It's seeing what just healthcare, definitely, in the private sector, even some international aspects of that is, what can we do to, share and steal shamelessly from each other to help each other be better today than we were yesterday. So that's always great to see, the other healthcare systems, what they're doing, some new things that we can bring back, as well as, kind of give back and share from the VA too.
Well, great. Well, all folks in healthcare have faced various challenges over the last couple of years. Are there any special challenges that you've seen in the VA that have required some sort of system solution?
Yeah, no, I think for a good part of the last decade, we've been trying to increase our virtual care modality. And then one day, we all clicked our heels and it happened, right? And so over building the infrastructure, getting to that point, and now we're at that point, what's the next? What are we going to do coming out of this? Or, how are we as staff? How are we as, taking care of our patients, our veterans? Where's that sweet spot of like on-site, virtual, what works well, and over the last 2 years that we've really kind of done and been able to get to, or what are some things we need to kind of get back to the old way, but still a better way of doing it. And so I think we're all going through that, trying to figure out what we can do. The new norm going forward, and what's that going to look like, the hybrid model of on-site virtual, and I think we're getting more and more used to both modalities, and so it's just from a process improvement perspective, it's opened up a whole new world of opportunities for us, as well as challenges of now job security, right?
Yeah.
So.
Well, we appreciate the work you do. We're glad to have you here. We certainly appreciate all the VA does to take care of our veterans. They deserve the best care available that anyone can offer.
Right.
So we're glad you're here. We're glad you're back at HSPI. We hope you have a great conference.
We understand the mission for not only our veterans, but for so many lives are definitely directly or indirectly affected by it, and know that more than just taking care of our veterans, helping support the whole healthcare system in general as a whole within the United States, and I think that's been a big part of the VA over the last couple of years too. So.
Absolutely. Well, thanks for all you do, and thanks so much for being with us today.
Glad to be here.
All right. Appreciate it.
Thank you.